Guys, welcome back to Medical Coding with Blue. Today's episode is all about distractions to avoid when you are learning medical billing and coding. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So, when you're learning medical billing and coding, or if you're thinking about learning medical billing and coding, there's a lot of things that can distract you from your ultimate goal, okay? And these distractions come in many different forms. So hopefully, by me telling you what to look out for, hopefully that'll keep you on track, or maybe it'll get you to get yourself in check, okay? Because distractions can be external or they can be internal. The worst distraction is the internal distraction, okay? But I want to say this field, health information, medical coding, medical billing and coding, is all a fantastic field to get into. Okay, when you're getting into this and you're saying to yourself, I want a long-term career, this is a long-term career. It's meant for those that want to study, that they want to learn more, they want to be challenged, and they want to have that fulfilling feeling, right, of enjoying what they do. But you'll never get there if you're always looking at it like, what's in it for me? Everything will flow and everything will appear right in front of you once you start doing your job, which is to learn. But again, if you're so distracted with, well, what's in it for me? And I'm all about the pay, and I'll get to that in a minute. Not in actual numbers, but I do want to address this. If you change your mindset and you start thinking about, let me prepare myself to be the best medical coder that I can be, that's when you're going to start seeing yourself be more successful, and not a moment sooner. Okay? So that I just want to say first and foremost. So the biggest distraction that you can have when you're starting in school is already thinking far ahead. It is already thinking like you're not even in school yet, or maybe you just started in the school. And you're saying, I'm concerned about getting a job. You don't even have a certification yet, and you're already worried about a job? You don't need to be worried about a job right now. What you need to be concentrated on is actually learning. If this is what you want to do, in order to prepare yourself to be the most successful, you need to be paying attention to what's in front of you. You don't need to be thinking about 10 or 12 months down the road when you're ready to start applying for jobs after you've taken your certification exam and passed it. Because hopefully you've been listening and you've been implementing a 20-hour per week study schedule, so that way you can keep yourself in line. And if you say, well, Blue, it's just a lot of money to put into learning, that is not true, because you can absolutely learn this for very low cost. And sometimes you can learn it for free, depending. There is the WIOA program, Workforce Innovation and Opportunity Act, right? When I was coming up, it was the WIA program, Workforce Innovation Act, right? But with the WIOA, these are funds that are set aside to help people get retrained into a better career field so that they're not working in like minimum wage. So if you are working in a minimum wage paying job, or if you are unemployed, or if you were laid off, there are funds in a program called the WIOA that will cover this. So you can actually go online and just Google WIOA, and you can see if you qualify. Or you can go to your workforce office, right? Your local workforce office. Some people call it the unemployment office, but some people call it the workforce office. You go there and you ask them about it, okay? Now, sometimes they'll have different professions. Sometimes they won't even have anything about medical coding, because in certain areas, people have told me that when they went to their workforce office, that they were told that there's not a big interest in that area. But it doesn't mean that you're without hope, because I have the independent study that is right in the description box below. And not only that, it has all of the books that you need to learn from. And you can purchase your coding manuals later on when you have some money. You could purchase them a book at a time. You can try to go to your public library in your city or town and see if they have a coding manual, the coding manuals you could check out. If not, again, you can always look online and try to find a cheap version for you to learn on. Now, if you are not ready to purchase this year's books and you want to purchase 2024 editions, so that way they're a year older, but you can still learn on those for right now. And then when you get ready to test, of course, get the correct manuals that you need so that way you can start learning. Optum, I always recommend Optum. They have fantastic sales on their books all the time. Okay, so that's just something that you guys ought to know. But I will say this, Optum stopped selling their 2024 editions. They usually stop selling them in January, the early part of January. And they never went down in price, other than what they were, which was they were still about $50 a piece, but that's still not a bad deal for considering that they're the coding manuals. Okay, so you can get good deals on books. There was a lady that watched the show a few lives ago when I did a live, and she told me she got all the books that I recommended for $284. And so now she's going to be doing the self-study. She's going to follow my syllabus that is free. I give this to y'all just freely. Whatever you need to see is going to be right there. And if you follow all of those things, you will learn what you need to learn so that you could take any of the 4 main medical coding certification exams, the CCS, the gold standard medical coding credentials, the CCA, the CCSP, or the CPC, right? The first 3 are with the American Health Information Management Association, and the CPC is a flagship credential for the American Academy of Professional Coders. So there's options out there, okay? So this whole thing of, oh, I got to spend all this money, I got to get a student loan. You should never get a student loan to learn medical billing and coding. I know some of you already did. You didn't know. You didn't know. But for those of you that don't know that you don't need to do that, now you know, okay? Because there's other resources and ways for you to learn medical billing and coding. You don't have to go through a formal program. And if you say, well, Blue, I am not disciplined enough to learn this by myself, you can always hire a tutor, okay, who you can meet with every other week or every week if you want to, depending on your budget and what you want to spend to learn, or have somebody right there coaching you. You know, I mean, it's entirely up to you, okay? There's a variety of charge prices when it comes to these tutors. And I tutor, my rate and contact is in the description box below. So again, it is entirely up to you. You have the ability to be able to control your experience with learning medical billing and coding. Some people don't know this, but you absolutely have the ability to control your experience. You may not be in a good program right now, and you may think, I'm not learning anything from this program, but if you try to supplement your learning with the independent study that I have below, that may help you to start getting it, okay? Again, you are in control of your own experience. But we need to limit the distraction of thinking so far ahead. If you are learning in school right now, you need to be focused on learning in school right now. You need to be focused on learning your medical terminology, your anatomy, pathophysiology, and your pharma. And that's your base foundation before you start learning the coding, okay? Because if you're trying to learn the coding before you learn all that other stuff, you're setting yourself up for failure, because you have to understand those terms in order to get the right things in the coding manual. Okay, so that's the first distraction you need to limit, is thinking so far ahead. If you know you are studying medical terminology, you stay in medical terminology until you finish it. If you know that right now, maybe you're in the coding portion of it, then you can incorporate all the things that you've learned, obviously, and you stay in that. Don't be thinking about so far ahead. Don't be thinking about the membership dues and the, going to conference or the fees or anything like that. You need to concentrate on what you have in front of you and focus on that, because all of that is wasted energy to be worried about something so far ahead. Because for the people that are saying, well, the pay is too low. I had this one ignorant lady, because she was ignorant. This is an ignorant comment. She says, well, I don't think that it's worth it, all of the studying that you have to do, and the pay is so low. First of all, ma'am, you don't know everything, and you clearly don't know anything if you think that the pay is too low. If you're looking at a private doctor's office, they're going to pay differently than a hospital group or like a big group, like a specialty group. They're going to pay completely differently. So if you're looking only for certain things, or if you're looking for remote medical coder, you're specifically putting that in, and you see what the starting salary is, which a lot of people miss this as well. Starting salary is not where you will stay. When I started in coding, I started off at a very good rate. I said, okay, this is a good salary. Well, when I finished that assignment, my first assignment, I went on to the next assignment, which was, I got done in 3 months with the first assignment. And then like a week later, 2 weeks later, I was on my next assignment that was supposed to be for 10 years. But I ended up getting here to my forever home in 8 months. And I had a huge jump in pay. I was like, oh, okay, well, this is good too, because I built up that experience. And then when I got here to my forever home, I got another jump in pay. A good jump in pay. So again, if you turn your nose up at the starting salary, oh, it's too low, please don't pursue this. This isn't for you. And yeah, I can say that because the simple fact that if you're coming in with just thinking about the money, you just want the money, and you're only focused on that, that's all you're going to be focused on. You're never, ever going to be satisfied. You're not going to enjoy what you do. If you don't enjoy what you do, if you don't enjoy the coding, if you don't enjoy the process, if you don't enjoy the learning, if you don't enjoy interacting with those providers, then the coding is not going to be as sharp. It's not going to be as crisp. It's not going to be as detailed as it should be, because why? You don't care. You're only concerned about the money, right? And so again, if you're always chasing money, you're never going to be satisfied with this career. So that's why I say the career field does not need more people that have that attitude. And I will say that I don't care if you dislike it. Because as far as I'm concerned, for those that are really passionate about wanting to learn, those that really want to do something with themselves and they want to pursue a career field, all of that other nonsense about worrying about money, guess what happens to those people that are not worried about money? They do what they're supposed to do. They start to build their skill. They start to learn more. They get more opportunities. And then guess what? Their pay goes up. Little by little by little by little bit. And sometimes it's not little. It's jumps. It's jumps. It's jumps. It really all depends on what you're doing and how you are navigating in your career field, how you are communicating your skills, and how you are making connections in the field so that you learn about those things. Because yes, there are some places that they don't understand what we do, so they're not going to take it seriously when you say, hey, I'm a coder. But then there's others that say, we really need a coder. We've been having so many denials and we don't know why. Our biller is not trained in coding, so we don't know what the problem is because we can't seem to get these bills paid. And then they get a good coder in there who has some semblance of competence, who knows what they're doing and really enjoys what they're doing, and all of a sudden they're making money hand over fist because now everything is coming out correctly. The codes are being applied correctly. The modifiers are being applied correctly. The evaluation and management levels are being applied correctly. The procedures are being applied correctly because that person really enjoys what they do. So then guess what? Now that facility is making money. So with their making money, now the coder and the biller are also making money as well. So that's the thing, guys. You have to look at it other than, oh, I don't want to do all that because it's all this hard work. If you think that that's the way that it is, this field is not for you. And again, I will say that because I can. Because I can. Because I know that people who actually do invest themselves into it and actually get it, those are the ones that make money, not the ones that are worried about it. Okay? So again, the distractions we need to avoid, thinking too far ahead, not being able to get a job when you're still in the school, be in the school. 2, being concerned about, not getting a high pay. And let's think about how stupid that sounds too. If you are brand new to an industry, you have no idea what you're doing. This company's taking a chance on you and they're paying you decently to start, right? Not the best that you would think, but still decent, right? Because you can look at the Department of Labor or the Bureau of Statistics and you can see what a medical coder starts off at in your area. No, I do not talk about actual figures on what a coder makes or what a coder should expect, because every place in the United States pays their coders differently. California has a different starting rate for coders versus Florida, versus Michigan, versus New York, versus Texas, versus Arizona, versus Wyoming. Every place has a different starting salary. That's why I have never given an exact figure. I know coders make good money, but I've never given an exact figure on this channel. Because again, the simple fact is, if you're coming to this channel and that's what you're looking for, I'm not going to give it to you, because this channel is for people who take the field seriously and they know that the money will come to them if you stop looking for it. Okay, so that's just what I'm going to say there. And for my nurses, you didn't start off at your high salary when you first started out of nursing school. So please, for those that want to give me attitude, oh, I'm not making the same. No, because the stakes are different. And again, you have to work yourself up just like everybody else. Do I need to remind everybody of the story of the nurse who followed my independent syllabus? She learned with the goal in mind. She learned with the goal in mind that she wanted to be a CDI. But she heard me, and she heard me when I said that you need to learn the coding first so that the CDI stuff makes sense. And she's a nurse, and they were telling her, do the CDI, don't worry about the coding. But then when she heard me, she's like, okay, well, I'm going to learn to do the coding. She learned to do the coding. She got her certification. Then she went and she worked, and she said that she took a pay cut, but she looked at it like paid training. And within 2 years of this, she was CDI, she got her CDI, and she's making more money than she did as a nurse. She got it. She understood it. That was not her motivator. That was not her drive. She wanted to do CDI. And everything fell into place because she listened. I'm just saying. So with that said, this field is very rewarding. But it's rewarding when the people are doing what they're supposed to be doing, which is learning. And if you complain that it's too much learning, it's too much, we have to know what doctors know while never having gone to medical school. And I don't tell you so that you're scared. I'm telling you so that you're prepared. Let me empower you in that way. Because again, for those that think that this is where, oh, you got to coddle me. I don't do coddling. I don't do coddling. If you fall, I'm going to tell you, get up and walk it off. I'm not going to be like, oh, are you okay? Oh, and letting you cry and go on. No. You need to get up, walk it off, keep going. Why? Because that's going to make you more resilient. That's going to make you stronger. That's what the purpose is, right? Because again, if somebody really cares about you, they're not going to allow you to be soft. They're not going to allow you to make mistakes and be like, oh, it's okay. No. What did we learn from this mistake? Okay, well, I learned that if I'm studying medical billing and coding, I shouldn't be focused and concentrated on the future. I need to be concentrated on right now. My energy needs to be focused here. Well, then guess what? Now that person's redirected their energy, and now they're able to start learning, and they're able to start like, okay, focusing on what they have to do. Those are the people that are going to be more successful. That's why I do what I do. Okay? So like it or not, this is the way that I am, and I'm not going to change. I will never change for anyone. Why? Because my message has helped countless people to get where they've got to go once they put their feelings aside. Okay? Because again, when you're living in the future, that creates anxiety. That creates uncertainty in yourself, and you're not able to focus on the right now because you're thinking about the future. Or if you're thinking about the past, the same thing. For those people that says, well, I'm always a failure and I fail all the time. I said this week about that one lady that was freaking out about, oh, I'm doomed, I'm going to fail already. Thinking about the future, getting all wound up because she's already failed in the past. So you living in the past and you anxious about the future because you can't be right here, right now. You can't be here right here, right now, like you're supposed to be. Does this make sense now? Does it make sense why I'm trying to get y'all to just focus on what you're supposed to be doing right now and don't worry about all of that? The time will come for you to work for, to think about all that, to plan for that. But if you are doing like you're supposed to, you're going to be getting that time and you're going to be learning coding, and then you're going to get to the test day and you're going to be able to pass your test because you've been putting in the study time. That's not going to be an issue for you. You're going to be able to get through it on the first pass, right? And then you're going to look at your skills. What are you bringing over? And you can have no prior history of medical. You can be completely like from a different industry and you could still be okay to start in this field, because I didn't have any experience in medical at all when I very first started. So there's hope if you're coming over from a non-coding position, because you're going to be talking about your skills. That's what you're going to be sharing with the employer. Oh, Blue, it's so hard. Are you going to get a job in the first 2 tries? Probably not, but maybe you will. You don't know that. And it may take you 100 places that you've applied. It may take you 200 places you've applied. It may take you 300 places you've applied, because that's not an unusual number. But again, when we focus on what we're doing in front of us and we start becoming intentional with our actions, that's when we're going to start seeing success. That's when we're going to start like, okay, making headway. Because if you're out there mindlessly blanketing these companies with your 2 or 3, 4 or 5 page resume, like I tell y'all not to do, and you're wondering why are you not getting a call? Well, because you got 3 or 4 or 5 pages. I wouldn't want to read a 3 or 4 or 5 page resume. You got to have 1 page resume. That resume only needs to go back 10 to 15 years. I don't care if you were a ward clerk 20 years ago and you say, well, I was doing coding back then. The coding is not the same back then as it is now. We were in ICD 9 times back then. So it's irrelevant. It's irrelevant to what is today. So if you are, again, being intentional and concentrated and focused on being present and personalizing those cover letters for that agency, wherever you're trying to apply, and you're putting in the job title that you're applying for with that specific organization, then that dumb AI is not going to just dismiss your resume right away. But if you get that automatic dismissal, what have I told y'all to do? Mail in a copy of your cover letter and your resume, and you can put on that cover letter that you applied through, you follow the protocol, you applied through the internet, but you wanted to follow up with a physical copy of your resume and cover letter. You look forward to hearing from them. It's not a guarantee it's going to work, but that's the person that I'm going to look at if I'm a hiring manager, because this person thought outside the box. This person did not let a rejection get in their way of wanting to let me know what their skills were and how they can help me as the employer, right? If I'm the hiring manager. Okay? So that's the thing that you got to think about. You can't just be so discouraged right away. It's a weakness of the mind that you just get so discouraged that you just want to give up only after a few tries. They're going to tell you no. I went through rejection too. And I went through this for 2 whole months because no one told me, not even at the school. No one said anything about the fact that you're going to go through all that. But I went to the temp agency ultimately, long story short. And that was how I got my first break. And people will ungratefully tell me, oh, I don't want a temp job. I just, I don't have, okay, well, again, I'm just telling you what my experience was so that maybe it could help you. And maybe if you tried it, instead of immediately dismissing it, maybe you might see some success there too, because the whole purpose of a temporary agency is to get you a job so that they can get paid. Now, any assignments that you go on as a coder, you can add that to your resume. It starts to become filler for your resume, because why? That organization, whoever hired the temp agency, just needs the coder to fill in for a person temporarily. As long as you can pass an assessment test, you will be fine. They will say, okay, we're going to go ahead and put you on the list for, if we have any jobs. Okay. And if you're not able to work, that's okay. Temporary agencies understand that. But you're going to at least get a chance to get in. And if you get in and they say, okay, this is a temp to perm position, right? We're going to try you out for a month or 2 months, and then we're going to hire you on permanently. That's even better. Then you're going to be performing well. They're going to be training you. They're going to be doing all these things, and they're going to make sure that they have somebody who is competent enough. They don't have to hire somebody blindly who I was going to say filed, who filled out an application with them and then was able to pass their assessment test one time. There's no other checks than that. Okay, well, that person may or may not work out. But if they go through a temporary agency, if they hire you and they say, okay, well, maybe it's working out, maybe it's not working out. If it's not working out, they can ask the temporary agency for another. What is going on with this light? They can ask the temporary agency for another coder, you know? So there's always options. There's a little bit of flexibility there, but you're still getting experience. Okay. So again, that's what's going to help you to make those connections and get hired in the future. All right. With another organization. Okay. But we need to start practicing being present so that we can alleviate all of that anxiety about the future or the regret of the past. Because again, anxiety and regret are useless emotions. Worry is a useless emotion as well. It's a natural human reaction, yes, but we cannot let it control us to the point where we don't even try anymore. To the point where we just say, okay, well, I'm overthinking it, so I'm thinking it's all of these things, when again, you don't know. And the other distraction that I want to bring up before I close this video is listening to ignorant people who are not coders, who are not in our field. And if you say, well, Blue, I have a friend that's a nurse and she told me, okay, is your nurse friend, is she even certified in coding? Well, no, but she knows a lot about coding. There's a difference between knowing a lot about coding, which I don't even know what you mean when you say that, because knowing a lot about coding to a nurse may mean that they're circling from a super bill. Okay, so that's not coding. That's data entry. That's circling from a super bill. Okay, so I'm going to turn this slide off here. Yeah, we're just do that. But yes, so don't listen to ignorant people. Don't listen to people that are not certified in coding. Okay, that's first of all. Second of all, you have the ability to make your own decisions about what you say and how you take it from that person. If you're going to take them seriously, if you're going to take what they say to heart. And then you got to think about that. Is this a person that you want to take to heart their advice? Or is it really good advice? You need to think about that. Again, looking for people who are actually in the field so that you can make an informed decision and you're doing your research is going to help with any kind of just not knowing anything about the industry. Okay. You have to be able to do your own research because that's such a huge part of what we do anyway. And if you're not doing that, that's a problem. Okay, if you're just listening to other people, you're allowing other people to control your destiny. That's a sad life right there. If you allow other people to control your destiny, because you never know what the intentions of that person is. If they secretly down low don't like you and they don't want you to succeed, and they're going to try to be a smiling friend to your face, and then behind your back they're talking all this crap about you. Oh, they'll never do it. They'll never do this and never do that. But then, oh, well, maybe you shouldn't, blah, blah, blah. Are you going to listen to somebody who's doing that to you? Absolutely not. Absolutely freaking not. Use your own agency. Use your own desires to drive you. But use that in a positive way. Quit living in the past because it's not going to do you any good. Quit living in the future because it hasn't happened yet. Be present and be in the right now. Okay? Don't worry about what's down the road. Make sure that you do your research. Don't listen to ignorant people. Okay? Don't listen to ignorant people. There's a lot of ignorant people out there that think they know about coding and they have no idea. Okay? Stop chasing money. Okay, if you're trying to do this because you want to chase money, don't do it for the money. Anybody who has ever loved a field that they're in has always said that. Don't do it for the money. But they themselves enjoy it. It's like actors that tell you don't go into acting for the money because you will hate it. It's the same thing. Don't go into coding for the money because you will hate it. You will resent all the things you have to learn and do. And instead of looking at it from the other side of, you know, I'm doing a lot of good. I'm doing a good service for somebody because I'm making sure that these providers are documenting clearly so that we understand what happened. The patient is going to have a really good medical record to take with them to the next provider that's going to see them, that's going to be taking over their care. The patient's going to be charged appropriately for the services that were provided to them. There's not going to be any misunderstanding about what happened to this patient. And that's where it all is. Medical coding is a very selfless field. And I have said that many times. It is selfless because we are thinking about others before we think about ourselves. And again, if you are doing what you're supposed to be doing, the money will follow you. That's my advice anyway. With that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see you all next time. Bye.